In the best of the rest of the news, after a series of high-profile mergers, the latest of which was Anthem's $54.2 billion purchase of Cigna, the number of major health insurance companies in the United States could soon be down to 3. That's right, 3 industry representatives. Of course, they say that the consolidation of America's major insurers into a triple monopoly isn't really all that big of a deal, but healthcare experts see the situation differently. The president of the American Medical Association, for example, said in a statement earlier this month that a lack of competition in health insurer markets is not in the best interests of patients or physicians. If a health insurer merger is likely to erode competition, employers and patients may be charged higher than competitive premiums, and physicians may be pressured to accept unfair terms that undermine their role as patient advocates and their ability to provide high-quality care. In other words, more consolidation equals higher prices and more expensive care. And that raises the question, if we are going to have a functionally monopolized healthcare system, wouldn't it be better just to hand it all over to Medicare? Let's ask Wendell Potter, Senior Analyst at the Center for Public Integrity, Senior Fellow in Healthcare at the Center for Media and Democracy, author of the book Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. And I should add, a former executive with one of the 2 health insurance companies that I just mentioned.
Well, in fact, both Humana and Cigna work for both of them, and Humana is being gobbled up by Aetna, and Cigna's being gobbled up by Anthem.
Yeah. So let's start at the beginning. What are the different ways that different countries fund health care?
Well, first of all, none fund health care like we do. Most of them have some kind of a government program that provides public financing for health care. There are different configurations of how that actually is implemented. In Canada, for example, it's more of a single-payer system in which the government, the federal government, and the provinces are funding health care.
So they essentially play the role of health insurance companies.
They do. And it's health care is privately administered or delivered. The physicians and hospitals are privately operated. They're not public institutions. In the UK, the doctors and hospitals, doctors work for the government typically, and the hospitals largely are owned by the
so that's more socialized medicine.
It's more socialized, exactly.
And how is it that the United States ended up with a program? In fact, actually, let me just show this short clip. This is from a Robert Greenwald movie, and it's about, from 2009. The dollar amounts here are astronomically higher now than they were then. But it's sort of lifestyles of the rich and famous CEOs of health insurance companies. Just take a look at this clip.
The big winners in this broken healthcare system, let's look at who they are. The CEO of United Health Group, Stephen Hemsley, his salary $3.2 million.
The incredible gross profits of the private health insurance industry that is at the core of the problem.
To live in a society that would allow the CEO and higher executives of United Healthcare to make $750 million in stock, it's disgusting.
It was also very frustrating to know that they made that money off the backs of people like me.
Where is all that money going?
I can't imagine the kind of house he has or houses.
Behind all those numbers are real people.
Now, once again, this was from 1999. I think things are frankly far worse now.
Oh, far worse.
How is it that we ended up with a healthcare system where you and I and pretty much everybody else in America who has health insurance is providing Stephen Hemsley with $750 million and a bunch of multi-million-dollar houses? How did that come to be?
Well, because we as a country didn't take the initiative like other countries around the world have done to establish some kind of a federal system or some kind of a central system that makes more sense and that has kept costs down and that frankly delivers better care, because we rank very, very poorly when you compare health outcomes in the United States against all the other countries in the developed world. We just sat back and let the private free market, if you will, work its magic, and this is what we wound up with.
This is the magic that it typically works. Yeah. But the reality is that these guys, Stephen Hemsley, the guy who made $750 million, and Bill McGuire, the guy who preceded him, who made $1.7 billion as the head of United Healthcare, and had to give back a couple $100 billion
because of some unethical practices.
Yeah, because of his frauds or unethical practices. Let's be politically correct here. This is just this ongoing process, and if we're going to be down to 3 health insurance companies in the United States shoveling hundreds of millions of dollars into the pockets of what, maybe 100, 200 executives? I understand that there's 100 people at United Healthcare who make more than $1 million a year.
Yeah, I'm not surprised. And with these mergers, those are the people who will benefit the most from this transaction if the regulators let it go forward. They make money, and most of the money they make, by the way, are through increased value of their stock options and stock grants.
So it's a hustle. Like I said, they're banksters basically.
Exactly.
This is a hustle.
Yeah.
Back in the 70s, I ran a business in Michigan, and we were able to provide health insurance to all of our employees. We had 18 employees, and my recollection is it was $35 a month a person. At the time, it was Blue Cross Blue Shield. They were a nonprofit. All the hospitals in Lansing, Michigan were nonprofit. I believe that the state required both to be nonprofit. I could be wrong, but I'm pretty sure that was the case. This was in the mid-70s.
It's typical.
When did that change? Is this something that came along with Reaganomics, this idea that anything that's being done well can be done for profit?
Yeah, it did. It was, and you started seeing the Blue Cross plans converting to for-profit status around that time. Now many of them are owned. The Anthem brand, by the way, it was previously known as WellPoint, and then they changed the name to Anthem because a lot of the plans had that name as well. Mm-hmm. WellPoint and Anthem actually merged. There were 2 companies. They both operated Blue Cross plans that were converted from nonprofit status to for-profit status. So now a lot of the Blue Cross plans are for-profit because they're now able to do that by changes in federal law and state laws. State laws, yeah.
So how do we... Senator Sanders is saying, just put everybody on Medicare, single-payer system. Yeah. Is there a more or less elegant way to do that, a more or less practical way to do that? What are your thoughts about that?
I think Senator Sanders is really onto something. I think that's where we ultimately will need to wind up. As long as you're trying to work the system or create the system with the private insurance companies as they are, they're in business to make money. That's what they're in business to do, and that's their number one objective is to enhance shareholder value,
rather than to heal people.
Exactly right. And keep in mind too that these are not the first mergers. We have now just 5 major big companies because of mergers that took place. When you were talking about when you were in Michigan, you probably, I'm sure, never heard of probably not even Humana or United Healthcare or WellPoint or Anthem. Those brands really were not
no, all I knew was Blue Cross Blue Shield.
Yeah, and just a few years after that is when the first rounds of mergers began to take place and the conversions of these nonprofits to for-profit status. That is when prices began to, healthcare costs and premiums began to go out through the roof.
So I want to dig a little deeper into this. So would it be accurate to say, Wendell, that we actually had a healthcare system and a way of paying for healthcare in the United States that didn't work all that terribly until the Reaganomics philosophy that anything that can be done on a nonprofit basis, and a nonprofit has to have as their first mission what they're doing. In other words, when Blue Cross Blue Shield was a not-for-profit, they were required by law, by policy, and by institutional whatever to first serve their patients. Yes. Once they became a for-profit, they were required by law, by institution, by philosophy, whatever, to first serve their stockholders.
Yes, exactly.
That's the fundamental change that has happened in the last 35 years.
You're absolutely right. The first Blue Cross plans were not only non-profit, they also practiced, or their business model was based on a community rating. There was no discrimination against people because of their age or their gender or health status. That came along after the for-profit life insurance companies saw an opportunity to make money in health care. And they began to go into markets and sell cheap coverage to people who were healthy and young.
Right.
And that screwed the whole system up.
So it was both the profitization,
Right.
and the deregulation
Yes.
of these companies. Right. So where do we go from here? What we mentioned Bernie's solution. There are legislative options. There are groups out there who are working on this. Who's doing what, and what do we need to know about? What the people who are watching right now? What do they need to know about what can be done?
Well, they need to know that it probably can happen. When I say moving to a single-payer system can happen probably at the state level, and I think it can. I think the chances of implementing it at the federal level are not as great as it is to start at the state level. And in fact, in Canada, it began at the provincial level. Saskatchewan was the first.
Equivalent of the state level.
Yeah, exactly. Saskatchewan was where it began in Canada, and over the period of a few years, other provinces began to take notice, and it ultimately became a federal program, with provinces still having quite a bit of autonomy even to this day. But I think the same thing can happen here. There's a lot of activity in California, for example, and Oregon and other states. And as you well know, there was an attempt in Vermont. It fell short, but I don't think it's over. I think that we can learn from the mistakes that were made in Vermont and elsewhere. Right. And I really think that we can get to a single payer. In fact, I have been working and been interviewed for a documentary that will be premiering not too far in the future about our healthcare system, acknowledging that we've made some progress with the Affordable Care Act, but we didn't fix anything close to the problems that need to be fixed, and it's not a sustainable system. So we really need to look abroad and within what we can be doing in this country that is uniquely American.
If we end up with only 3 health insurance companies, basically,
right.
I mean, isn't that sort of the emperor has no clothes moment? Isn't that couldn't that be the moment when Americans look and say, wait a minute, that's not competition.
Yeah.
That's not, screw this. I mean, why are we giving $1 billion to a CEO when we could be healing, we could be vaccinating 10,000 children?
I think there will come a time pretty soon when the American public will say, this just makes no sense. When you've just got 3 big insurance companies, that may not happen because it could be that they're not approved. But I think it could happen that Americans will start to wake up and demand something better.
From your lips to God's ears.
Thanks very much,
It's
Tom.
always great to have you.